Myself, Dr. Manisha Deshpande. I am a consultant physiotherapist with an experience of more than 35 years. I want to discuss regarding the common physiotherapy issues which we face in our practice. The most common thing is the back pain. Now this back pain we can divide into the cervical pain and the lower back. The cervical pain, which oftenly patient use the term as a cervical spondylosis. It is not so. Most of the time the young people which come to us for the neck pain are the sufferers of the mechanical neck pain. And why this mechanical neck pain occurs? It is because of the wrong posture. All the time we are busy on the social media, holding the mobiles in the hand, or in the office we do online work, and there are haphazard timings, and work from home again you are sleeping, sitting and putting the laptop in the wrong position, and all the time bending forward hours together without moving in between. So these are all common postural problems which leads to the mechanical neck pain, and if it remains like that untreated, it can cause the cervical spondylosis changes or the degenerative arthritic changes in the spine at a very early age. So what can be done to avoid this? So we have to go to a physiotherapist to have a ergonomic advice. What is ergonomic advice? Ergonomic advice means the physiotherapist advises you how should be your sitting posture, how you modify your workstation, that is the height of the table, the screen, monitor, how you hold your mouse, and what you should do in between. Those are called as the workstation exercises. So in between working hours you have to take a few minutes break, do some exercises at your sitting place only, and again start working. So if you do this, have a healthy lifestyle, good eating habits, maintain the calcium intake and iron intake of the body, and keep moving. If you keep on moving, then these problems can be avoided, and the arthritic changes, which often termed as a cervical spondylosis, can be avoided in the young generation. But although after taking the precautions, if you suffer from the cervical spondylosis, then you have to visit to the orthopedic surgeon as well as a physiotherapist. Now what the physiotherapist can do? Physiotherapist will assess you, physiotherapist will check your ranges, do some special test to diagnose what kind of cervical problem you have, and accordingly the physiotherapist will guide you, give you some therapies to reduce your pain, to increase your range of motion. Today we shall be discussing about the low back pain. What are the common causes for getting the lower back pain? Now lower back pain can be seen in the young as well as in the older people, and it is the commonest cause for the workplace abscess across the world. The back pain, again we divide it into the mechanical back pain, which can be because of the wrong posture, obesity and lack of exercises. The second commonest cause is the prolapsed intervertebral disc, or often patient commonly term it as a PID or sciatica. So all the back pain is not always the sciatica. When a particular disc level, that is the L5 S1, is prolapsed, that time you get pain at the back of your thigh. That time it is termed as a sciatica. Then there are back pain which is a result of the tightness in the muscles, because we often use one type of posture all the time, which results into tightness of certain group of muscle and elongation of certain opposite group of muscle. If this muscle imbalance develops, it alters the length tension relationship between the opposite group of muscles, and again it causes the back pain. So the diagnosis of the back pain is very important. All back pain cannot be treated in same way. So first you have to consult to the physiotherapist. Physiotherapist will assess you, do the special test, and she will diagnose what is the cause of your back pain, whether it is a prolapsed intervertebral disc, whether it is a lumbar spondylosis, whether it is infective in origin. Often in our country we get the tuberculosis of the spine, which also results into the back pain. Then in the older group, because of the osteoporosis, there is sometimes there can be a collapse of the vertebra, again resulting into the back pain. So if she feels, then some investigations needs to be done, or most of the time the patients are coming from the orthopedic surgeon after taking the advices, and in that case they do all have the investigations. Again, the lack of vitamin D3 or the deficiency in the D3 and B12 level, it also leads to the back pain. So once the cause is established, then accordingly the treatment can be given, which can be some medicines, then physiotherapy modalities and exercises and posture correction. So if you take the correct advice at the correct time, this lingering, many times patients feel that it will be there with lifelong, this problem of back pain can be avoided. Thank you.
Madam, you spoke about few vitamins which requires body. So do you one need to take test before taking these vitamin, like vitamin D3 is less in my body and then I have to take in proportion, or normal patient can do it can take it on its own regularly?
It is better to have it investigated first, because sometimes the back pain cause may not be because of the D3 deficiency, and if you take the overdose, that may lead to the D3 toxicity. So to avoid that, it is better to know preliminary levels of the D3.
Thank you, Dr. Ma'am.